Barlett. Hello and welcome to the Veteran Voices panel. We thought it would be fitting to end this conference hearing directly from veterans themselves, and I'm particularly excited to feature an all-women veteran panel. I'm going to keep this conversational by starting with some topics for our panelists today, but I'll keep an eye out on the chat for any questions from attendees, so please feel free to provide comments there. And as a reminder, there are no conflicts of interest to declare. And so with that, I'm going to change it up just a little bit in that I'd like to ask each panelist to introduce themselves and talk about their background, their organization, and hearing directly about them and their voice. And we'll start first with Chelsea Chocos.
Hi, everybody. I'm Chelsea Chocos, as Annalise said. I currently work for CareQuest Institute for Oral Health as a project coordinator with the Health Improvement Team. In that role, I actually focus a lot of my time working in partnership with AIDPH, working on veteran oral health. I am a Navy veteran. I served 4 years in the military as a hospital corpsman. I worked with active duty and dependents and retired military at NAS Jacksonville, Florida. And then I also was attached with Marines at 1st Med Battalion. As I was doing that, I kind of was exposed to healthcare administration, which led me to get my undergraduate degree at the University of North Florida in healthcare administration. And then eventually I got my master's in management.
Awesome. Thanks so much for being here, Chelsea. Tammy, would you like to introduce yourself?
Good afternoon, everyone. My name is Tammy Barlett. I'm Deputy Director of National Legislative Service. This is here at the VFW, the Veterans of Foreign Wars. Recently worked with IADPH on their oral health survey along with the white paper. I was an operations specialist in the Coast Guard from 1995 to 2003, which included a patrol to the Persian Gulf on the cutter Chase, which granted me my VFW eligibility. After I was done with my Coast Guard career, I moved back home and became a compounding sterile pharmacy technician for many years before I decided to go back to school, where I received my undergrad in public health at Temple University, and a few years ago finished up my master's in public health at George Washington University, specializing in policy. 3 years ago, I was involved in the VFW SVA Legislation Fellowship, where my proposal was oral care as preventative care for the veteran population. And that program allowed me to meet with members of Congress and try to push forward that initiative. The VFW itself is 1.5 million members strong between the members and the auxiliary. We cover all 50 states and many foreign territories. Our members have served in the armed forces in war, campaigns, or expeditionary on foreign soil, or in hostile waters. And the VFW and its auxiliary is dedicated to veteran service, legislative advocacy, and military and community service projects. Great to be here.
Thanks, Tammy. And Ashley, would you like to join us and introduce yourself?
Absolutely. Thank you so much for having me. I'm Ashley Carruthers. I'm the current operations director of Minority Veterans of America, where we are designed to create belonging and advance equity for underrepresented veterans, which includes women, people of color, LGBTQ community, religious and non-religious minorities. And we strictly aim to transform the narrative of the American veteran. I am an Air Force veteran. I was a supply troop for 8 years in the Air Force, served with the Army, deployed in Iraq, and supported NATO forces in Kyrgyzstan. And in my current role, I'm over programming, finance, and really pushing those stories that people don't actually get to hear out to the world. And we do a lot of advocacy work on the Hill, and we've been called to testify a number of times. And we continue to strive to work and build relationships with other veteran service organizations. And it's been an incredible journey. We're happy to be here today.
Wonderful. And thank you all for the work that you're doing, and thank you for your service. I'd like to start today thinking about active duty. I know we've talked a lot about veteran oral health and what it looks like when you separate from the military, but really the oral health care process starts in active duty. And I think that's a very unique experience for veterans. And so can we talk about how your active duty dental and oral health care experiences may have shaped how you think about your oral health care now as a veteran? And Tammy, if it's okay, I think we'll start with you.
Sure. So Coast Guard is a very small service, and we fall under Homeland Security, so it's not exactly under the DoD umbrella, but we rely a lot on the DoD dental. So I think that's the biggest barrier that the Coast Guard faces, is having to make sure that our service members, our coasties, have that connection with the local dental offices. I know when I was stationed in Long Beach, California, we had to go to, I believe it was Edwards Airport, or the local Air Force Base. If the services there were not available, we actually went to the VA hospital there in Long Beach to receive our services. So yeah, having that disconnect a little bit kind of continued on in my after service time, having issues with trying to connect with dental services along the way.
Chelsea, what about you? How have you experienced the transition from active duty into separation, and how has that influenced your oral health now?
So Navy is a little bit different. I think every branch is. So we actually do have our own dental services. And obviously being a hospital corpsman, I was not directly connected, but we were in the same building most times. So really, you have your biannual exam and then your yearly exam and biannual cleaning. And those are just checks in the box, basically to make sure that if you get deployed, that you're not going to have to be sent somewhere else and they're going to have to spend money on you to do some extensive dental procedure. So I think carrying out into now, I kind of have done that, like check in the box. There's nobody making sure that I'm going to my dental exam. So I have not received dental services since I've been out. I'm also a military spouse, so moving and having to find a dental provider that takes my dental insurance is, frustrating. And if I don't need it, I'm not going to use it. So that's kind of my thought process now.
Ashley, how does that sound to you? Do you have similar experiences to Tammy and Chelsea?
I do. Prior to service, there was a lack of healthcare, so there was a barrier to get dental care. But once active duty, again, Air Force, same as the Navy, they're checking that box, right? So we want to just make sure, a peek in the mouth to make sure everything's good to go before we send you downrange. Or if you're PCSing, it's another check in the box. The Air Force does have a dental program. Depending on your dental needs, you might get lucky, and if you need braces or some sort of oral surgery, you might make the list to get there. Coming out with the VA, I was not allowed to get a dental checkup with the VA, and I noticed with a lot of the veterans that were with me in the same bucket, checking into Chicago, North Chicago to be exact, to see the VA to get dental health care. We were not allowed unless you had an issue, or depending on what your paperwork said on your DD 214, if you would be able to get a checkup.
So it sounds like I'm hearing some barriers here and there that all of you have discussed, which is unfortunate. And Ashley, maybe you can talk a little bit about, which again I hear echo with Chelsea and Tammy, is the education piece. And was it ever discussed with you while on active duty that your dental care or your oral health care is connected to anything else? It sounds like there's a big check on military readiness and ensuring that you're ready to go from checking the box. Is there any other educational pieces or any sort of whole person health around your oral health care experience? And that was for Ashley, if you don't mind kicking us off.
Yeah, absolutely. So from what I can recall on active duty, there was no relevant speech to kind of bring, the whole person concept. When they would talk about whole person and taking care of yourself and your health, it left out dental, basically. So we were talking about mental and physical health and how those are connected. But dental health was never part of that equation. And I can kind of see that relevant within the VA now. There's not a whole lot of talk about it. When I do show up for an annual exam, we don't even mention dental. So it's kind of interesting in that respect, how it kind of carries over from one to the next.
And I was just going to say, I know within the Navy, I don't know about other branches, but Navy, your medical record and your dental record are completely separate. So you're carrying two records around. So there's no communication between the two. And then obviously when you go in for your dental exam, they're not telling you that if you dip or something like that, it could obviously have an effect on your mouth, but like, what could that do for you medically? So I think there's that disconnect. I mean, it happens outside in the civilian world too, but very much so within the military. And it's crazy to me because they are in the same building, like they could easily communicate with each other, but they just don't.
Yeah, I think there's a huge miscommunication there and a lack of education all around. And you're right. I remember going to dental, like they would ask if you smoke, but that's it. Again, just checking a box. Do you dip? No, checking a box, and that was it.
I know myself, I've heard horror stories, and I have a very close friend of mine who actually was able to get a service-connected disability claim done for her TMJ because she had her wisdom teeth violently pulled out in boot camp. And I know others who, maybe have had several impact wisdom teeth and had issues going along throughout their service and then receiving service compensate afterwards.
Tammy, that brings up service-connected disabilities and how that impacts your dental care after active duty. I'm wondering if maybe you can give an overview of the eligibility criteria or how service-connected disabilities are related to oral health care access.
Sure. Like we've been talking, oral health is kind of like seen as something completely different through the VA and throughout our healthcare systems overall. So even within VA, it's very niched. So to be eligible for VA dental care, you either have to be service connected with a dental disability or condition, such as TMJ. You must have a service connected disability of 100%. Be a prisoner of war, your vocational rehabilitation participants. So those are individuals who've had some service-connected disability, which allows them to get additional either education or employability assistance to be employable within their disability. And then also those who've recently discharged or released within 180 days. And that 180-day one is pretty much, I think in the last 10 years that has come about. So yeah, very niche, small percentage of the veteran population that uses the health system.
And I know that we highlighted in our white paper, and Chelsea was a co-author on that paper, the paper between AIDPH and CareQuest that sort of served as a framework for this conference, that on the conservative end, about 15% of veterans fit into that eligibility criteria. And what we found interesting was of that 15%, the utilization rate is around 1/3. And thinking through, obviously the 85% that don't have coverage through the VA, but just of those who are eligible and not accessing care. I'm wondering if you guys have any thoughts about, where's the disconnect there between having the eligibility and not accessing it? Are there any thoughts that you have as to why that maybe, or personal experiences around that disconnect? And Tammy, I'll start with you if that's okay.
Sure. For me, overall, with the health VHA, the disconnect is scheduling appointments. It's not like I can go through my healthy vet and pick out a date and time that I see that a slot's available. I have to call, and usually I'm on hold for a minimum, I think like 10, 15 minutes until I actually get someone that I can make an appointment with, and then I'm waiting for those appointments. So when we talk about dental care within VA, I feel a large barrier is the wait times. VA has an outward public-facing website that gives wait times for all the other specialties and the facilities within, except for dental. And I think that's something that needs to be put out there. Also, dental services at VA are limited in options. They don't really do root canals and crown caps. They will do tooth extractions instead. Those veterans who have spinal cord injuries, ensuring that they have weight share tippers and ample space for those veterans to come in, and then just being intimidated with having someone hovering right over you and not being able to hold a conversation or speak up for your voice while you're there.
Ashley or Chelsea, have you guys had sort of similar experiences or any thoughts about that utilization piece?
Absolutely. There's a lot of folks in the same boat about time. You can never see or access what they have available. It's often a waiting game of you to hear back from the VA. On that notion of speaking up for yourself, there's a lot of veterans that feel uncomfortable using VA healthcare because of what they've experienced on active duty. So when we build out, a women's care clinic for women veterans, are we thinking about the implications there when we move them over to another unit for dental, for example, that's already very limited? Are they going to be comfortable enough to go see that area? If not, who is there to represent them and be their voice? So we see a lot of barriers there. And some facilities might not have enough access. So a veteran might have to travel somewhere else to get care.
I was just going to say, I agree with both what Tammy and Ashley said. Obviously, access, utilization, not being able to get in for an appointment. I think in our research, when we were doing the white paper, we received a report saying that the third available appointment, which most medical services use for availability, was 90 days out. That's a little ridiculous. If someone really needs to be seen, if they're experiencing pain, those people are going to go to emergency room to get care. They're not going to wait around 90 days. In pain in their mouth. And then also the experiences that they have in the military. I know I had to have a dental procedure while I was in the military, and you're awake. They just numb you up and they put blindfolds over you. That is not an experience I want to go through again. So even if I was eligible for VA dentistry, I would not be going there. I would rather have a more personalized experience and go to a private practice.
Chelsea, that really brings up an interesting issue that Tammy also mentioned, which is prioritizing trauma-informed care for veterans, which was one of our 8 strategic recommendations in the white paper, as you know. And, we made that recommendation, and as we were kind of piecing through the literature, there's not a lot available on oral health and trauma-informed approaches for veterans, but there is a lot of information on trauma-informed approaches generally. And thinking about that recommendation, do you feel like it's a priority, and why? And Chelsea, how would you kind of frame that in your experience?
I think a lot of providers just simply asking the question if they are a veteran, and just being knowledgeable of what that entails, personally and within their experience within dentistry and medical. Doing procedures while you're awake, that doesn't seem like anybody would want to go through that. So if you have a patient that's coming into your office and you just ask the simple question, have you ever served? You can probably, guarantee that they most likely have a traumatic experience, whether that be, the care they received or a personal experience, especially if they're deployed. I mean, PTSD, I think there's reports out there that basically say like those people won't divulge the information that they have PTSD or they've been through a traumatic experience, but they also won't really go for care because it's an uncomfortable situation for them.
Tammy, do you have anything to add?
Just wanted to add, like you mentioned, Chelsea, toxic exposure. So just asking that question, have you served? We'll start off a conversation. We see it in Hawaii with the water exposure. So it's obviously going to be leading to possibly issues within the mouth. So just having a slight grasp, if that patient of yours sitting right there had served in the military or not, can help a long way.
Really simple question, right? Ashley, what are your thoughts on trauma-informed care or mental health and oral health in veterans?
I agree with both Tammy and Chelsea. There's a lot there that we have yet to uncover and discover, especially with the trans community. They definitely don't feel comfortable. That's a more vulnerable state to be in. And so I think having conversations with medical staff is very important, and having folks stand up for others. You might not be in that bucket, but I guarantee those folks have some sort of trauma dealing with medical in one way or another that leads back to dental. And so a lot of folks are going to refuse to go see and use that care.
So that's a great point, Ashley. And I know we've talked a little bit about barriers to care, and I want to call out what Teresa added in the chat over here, which is the VA dental clinics are usually in urban cities, and the veteran population really struggles in rural areas. And our white paper highlighted that veterans are sort of disproportionately concentrated in rural areas. There are higher concentrations of veterans in rural areas. And so how can we sort of support their unique needs? And, are there any thoughts that you guys want to share around rural veterans? Ashley, I see you're unmuted.
So I think there's a lot that can be done there in connection and getting, staff that are outside the VA to assist in caring for those veterans so they don't have to travel. Another barrier to getting to those cities to get the healthcare that they need is the lack of a vehicle. That transportation is vital for a lot of folks. I see prices continuing to go up and rise. And so a lot of folks will take a look at, okay, do I make it to my VA appointment that's 2 hours away, or do I go buy groceries? So I think, that's a huge barrier. So if there's a way that the VA can team up with local organizations to get this taken care of and ensure that they can get to a closer facility would be vital.
Continue off what Ashley was mentioning about the automobile. So when a veteran has a severe condition that they would have to have an adaptive vehicle, they can only get that loan once in their lifetime. And I'm sure we all own more than one car. So there's a push from the VSOs and the MSOs to allow that automotive assistance loan to be offered more than once in that veteran's lifetime. Also looking at teledentistry, just being able to maybe go to a CBOC or their local rural CBOC or a dental site or an Atlas site, something like that would be able to offer that teledentistry before the commitment has to be made for that long travel.
And then I would just carry off what Ashley said. Basically, using the community health centers or whatever services are available in those cities that these veterans are living in. I know for healthcare, there's that the CCN now that can be utilized. It should be very similar for dental, especially those that are eligible for dental care. Like that's a start. Just let them see a dentist in their area.
Well, and Chelsea, what you just mentioned leads into a chat question from Dr. Miller, and talking about advocacy and legislation for envisioning policy or implementation that provides VA dental care to all veterans, and specifically mentioning a bill that's currently in committee offered by Senator Sanders that would expand eligibility for veterans through the VA. So I think the question is, do you have any responses to that? Do you feel like that's a viable policy option, or do you feel like there are other opportunities around that? And Ashley, if it's okay, I think we'll start with you.
Sure. I think it's a great start. Anything at this point is a good start, right? When we're talking about veteran advocacy. And I do think that we are headed in the right direction. And there's always going to be room to improve and expand upon. And I think one thing I would mention is getting in the door with some of these folks, these congressmen and women, to talk about some of the issues that surround the veteran community more, and bring up those stories so they can further, that helps advance some of these policies, right? Because then they can see issues that might hinder the policy in a few years, things like that. So I think that's a vital thing to continue.
And Tammy, have you been working, or familiar with the bill, or have any thoughts on policy implications here?
So even as my time as a VFW SBA legislation fellow, that was something that was on my radar. S3017 from Senator Sanders is something that the VFW supports. Looking at veterans with comorbidities like diabetes and obesity and cardiovascular disease and Alzheimer's. The list is long, but just being able to have a start point and show that initiative of expanding dental care for those veterans who need it or who are in a health crisis, and how that benefits their life down the road is so impactful.
Chelsea, what would you add to that?
I just say that I agree. It is a start. And I think the people that receive, or the veterans that receive medical care, would be the first that need to be seen for dental. So like Tammy and Chelsea both said, or Ashley both said, it's a starting point. It's something we can build off of in the future. So totally agree with that, Bill.
Well, and I think in the same vein too, I want to highlight what Steve put in the chat earlier, and really talking about combinations of utilizing care. So he talked about that he, as a veteran, utilizes military health benefits and uses a combination of both to meet his needs. And I'm curious about whether or not, any of you have feedback on other opportunities aside from just expanding the VHA. Are there any other models of care that you feel like are working well for veterans? Feel free to popcorn that.
I think right now with the niche eligibility before it can be expanded, the VDEP, the Veteran Dental Insurance, is a program that it has no outreach program. So not many veterans are aware that that's even offered, that, the partnership with Delta Dental can provide dental insurance for a veteran at a very, very low cost. They're not eligible for it through the VA.
And Tammy, maybe you can just talk about that. You mentioned the VA DIP. What is that program? And how would a veteran access it?
Sure. I'll go ahead and put the link up into the chat, but there's a website. I think if you just Google VA DIP, like va.gov, it will pop up the VA's website. And what it is a simple dental plan that has been coordinated between VA and other dental insurances, including Delta Dental, to be able to provide affordable dental coverage for veterans. And like I said, it's one of the most unknown programs in VA. And it recently was expanded. It had been just a pilot program, but they were able to put it through the NDAA and open it up past that.
Chelsea and Ashley.
I was just going to say, I had no idea that I was even eligible for VA DIP. When I got out of the military, it wasn't in existence yet, but 2 years later, it would have been perfect. Like, I probably needed a dental exam at that point, but I didn't have the means to get any dental insurance. And I was in school, so I wasn't going to spend money on buying a private plan, but VADEP could have been the solution for me. So I agree, there should be some type of outreach. I don't know what that looks like. Obviously, the VHA sends out letters. Like, I get mail all the time. Like, it could have been something simple, especially with your, explaining your benefits, just like a little blurb saying you're eligible for VADEP if you need dental insurance.
I agree. Outreach is so important. And I think it should be something mentioned at your annual. So when you do have that veteran sitting in front of you, mention it. Be like, did you know this is available to you and you can access it? And then point them in the direction of where to find more information, whether it's, all right, go down the hall, take 2 rights and a left, go up the elevator and speak to whoever in this office, or simple website access, right? Help that veteran kind of find it. So I think you're right, Chelsea. It probably gets lost in the shuffle because we do get an enormous amount of mail from the VA, even email sometimes, but it's just, it can get lost in a newsletter. So
I know Dr. Trapp from the VA put in a question about on the thoughts on the scope and cost of services for expansion. So I know that's a common consideration. Anytime you expand any form of healthcare, is paying for it, and how would we then support it through workforce? And I want to highlight too that this was actually recommendation number one in the white paper that we put out, is to expand eligibility. And also, if we expand eligibility, to ensure that the workforce is fully funded in order to support that expanded eligibility. But thinking about funding and workforce, Tammy, I'm wondering if you have any responses to that.
Yeah, I agree. And it's something that I've tried to keep in mind as I read through legislation and put the VFW support towards, is that when we talk about workforce, we're not just talking about the dentist. We're also talking about the dental hygienists, those who are earning a lower pay, but also still have those student loans because they needed to get educated and accredited to a point. So ensuring that VA offers that scholarship funding program to them also is very important.
Chelsea or Ashley, anything to add to that? I know I have some thoughts on potentially saving cost of care by providing effective oral health care for whole person health. And we know we have some data available that says if you're able to expand access to periodontal care, that you can actually realize a cost savings in chronic disease management like heart disease and diabetes. And we know that those have particular exacerbations in relation to oral health care. So I'd love to be able to talk about that more offline, Dr. Trapp, if you're interested, but I don't want to take up the oxygen in the room. I do want to point out a little bit more here in the chat, talking about how veterans are struggling to just afford VA dental insurance. And I think that's an important piece to point out, that even though the program may be underutilized, barriers are still experienced. And actually, Steve in the chat also beat me to it, talking about costs of diabetic care and cost saving measures. And I love that was pointed out. I want to say before we close out, we have about 10 minutes, and I love the discussion going on in the chat, but I also think it's important. Are there any topics that you feel like we haven't covered, or anything that you feel like should really be emphasized before we close out today? And do each one of you maybe want to leave us with some closing thoughts? So, for instance, if we were to look through the variety of barriers or even opportunities to care, let me reframe that. That's actually where I want to go with that. Where do you feel like, I know we spent a lot of time talking about barriers. So where do you feel like the opportunities actually are? Where are our biggest successes, and where can we build on those to grow those opportunities as it relates to veteran dental care? And Ashley, maybe I can start with you on that response.
Sure. I see as you talk to folks and you get more stories, there's not always a lot of horror stories. And I think somebody brought that up in the chat earlier. Some veterans have excellent access to care, and they're near a facility that is just tremendous and doing wonderful work. And I think there's an opportunity, because a lot of them I see are linked up or near and working with a local university. So that university hospital kind of steps in and helps with care. And I think that might be an opportunity to open more doors, to get some more folks in. I see a scholarship, opportunity there, and it helps recruit more talent to the VA as a whole. So I think that might be a great opportunity.
Tammy and Chelsea, where are the opportunities that you see that we could build on?
Just, first of all, changing the narrative of oral care. It's not something that's separate. It's something that keeps us whole. We talk about our health of our mouth is the beginning of our digestive system. So if we're unable to keep that working, properly and without pain, I mean, we choose healthier foods and we choose a healthier lifestyle if we're able to do that without pain.
I have a lot of thoughts on this, but I think to start, like obviously the connection between, overall health and oral health, those veterans that are seen at a VHA, that's that's a large system, connecting the dot between medical and dental for those patients that are seen within the VHA by simply asking, like, do you have an oral health provider? And obviously they would know if they're eligible for the dental services that the VA has, so they could easily connect that dot for them. I think also, looking at like income of veterans, because I think most of us on this panel, we're in a situation where, we can afford dental care and we probably have other means of getting that dental care. But there's veterans that do not, homeless veterans. They are probably in the most dire situation, and they should be provided that care. And doing like a scale of like, I think the VHA does the same thing for certain benefits, but basically doing that for dental, like if you don't have this much income, you should be eligible for free dental care through the VA or through a community health center, making that connection. I'll leave it at that.
Well, and I think it brings me to sort of our closing question today, which is if you can leave us with a call to action, as veterans, I fully believe that we need to be listening to your opinions, perspectives, and designing systems that have you in mind. And granted, you can't represent the entire veteran community, but if you could leave us with a call to action and say, from this, please take away XYZ or do XYZ or collaborate with XYZ, where would you leave us with that call to action? And Ashley, I'll start with you this time.
I would say relationships and building partnerships with folks and allowing folks to tell their story. We continue to see the same faces, the same voices over and over again on repeat from the veteran community. But there's other voices, there's horror stories out there, there's success stories. And I think that will help charge us forward and see where the issues lie and bring that whole health back into the picture for folks, starting with dental and making sure we're eating right, making sure we have access to healthy food, healthy options for care, and getting those partnerships built out.
Tammy, what call to action would you leave with us?
I would leave pretty much what I've been preaching this whole time is oral care is preventative care. But we talk about, like you mentioned, Ashley, stories and access and just being aware of that patient who's in front of you. If you're aware that they had served, you might, if you were a pulmonologist, you might be inclined to listen to their lungs a little better because they might have been next to a burn pit. So just even having that idea. So oral care as preventative care, making that connection and discussing that, it can help so much. Like I mentioned, from obesity, the mouth, tongue, gums are right there at the beginning of the digestive system. And the less pain, it's just easier to chew, more healthier foods. And many oral diseases and conditions are preventable with early treatment. So if there's awareness that this is going on before it gets too far along, where we're unable to turn it back around, is so beneficial.
I agree with Tammy. I'm just going to go back to the simple question, have you ever served? I think that's the most important anybody can do. Especially you look at this panel, I don't think we probably are, we walk into a doctor's office, they don't assume that we're a veteran, but you should ask everybody because all of our experiences are different and we may have been exposed to a burn pit or been blown up by an IUD and had our jaws, blown off basically. Those are like simple things that could be connected and then obviously taken care of just by a simple question.
Thank you guys so much. I hope everybody was listening. I know I was taking notes. I have my call to action. I appreciate all of you pointing me in the right direction too. And so before we close today, I wanted to also just give Chelsea the opportunity, representing CareQuest Institute for Oral Health. Are there any words of closing that you'd like to provide on behalf of CareQuest for today?
Yes. So on behalf of CareQuest Institute for Oral Health, I just want to say thank you for joining us the past 2 days to bring further awareness to the topic of veteran oral health. And thank you to AIDPH for putting on such a great event. We hope you all walk away with a better understanding of the issues faced by the veteran population regarding their oral health. And hopefully we spark some ideas of how we can work to close the existing gaps. Although the colloquium is coming to a close, CareQuest Institute and AIDPH's partnership and dedication to veteran oral health doesn't end today. It only marks the path continuing forward. And with that, I'll turn it back to Annalise.
Thanks so much, Chelsea. And thank you again to all of our panelists here. I see lots of thanks in the chat. And I really appreciate you taking the time to share your perspectives. And we hope that your voices have been heard today throughout this colloquium. I, of course, want to thank our partners in planning at CareQuest Institute for Oral Health. I also want to provide the CEU code. Don't want to navigate away before we provide that. And so the CEU code for today's session is Voices 216 VET or VET. So Voices 216 VET. And again, you can put that code into the evaluation provided at the end of the conference. It'll be sent out probably either today or very early tomorrow. And I also want to say another special thank you to our partners and sponsors at the American Dental Association, Patterson Dental, Aspen Dental, and Delta Dental Foundation. I hope you were able to chat with them and learn more about what they're doing to support veteran oral health. And lastly, thank you to everyone who engaged in this colloquium over the past 2 days. I know it was a lot of information, and we hope that you found it valuable. And we hope that you know that you can reach out to us anytime moving forward as we invest further in our long-term commitment to veteran oral health. Thank you all.